Factor 5. 1. Success in implant treatment requires both osseointegration and a sufficient soft tissue collar. 2. Aesthetics in implant restoration, more challenging compared to conventional restorations. 3. Key considerations. Thick soft tissue biotype does not negate the need for the labial plate of bone. Thick labial plate and biotype may eliminate the need for soft tissue augmentation. 4. Long-term success depends on osseointegration for function and soft tissue integration for aesthetics. 5 factors affecting aesthetics: patient smile line, tooth position, soft tissue biotype, bony anatomy at the implant site, and implant positioning. 6 patient selection. Low smile lines are favorable for aesthetic outcomes. 7 immediate implant placement requires intact bone socket and adequate soft tissue biotype. 8 challenges with high smile line, more difficult in immediate implant placement. 9 tooth position in the anterior zone, critical due to labial inclination, thin soft tissue biotype, and thin labial bone. 10 soft tissue biotypes: thin scalloped, thin gingiva; thick flat, thick gingiva positioned coronally; thick scalloped, similar to thin scalloped but thicker. 11 papilla restoration challenges: more difficult with thin biotype and low papilla, easier with thick biotype. 12 bone augmentation in thin biotypes, necessary to prevent recession and peri-implant defects. 13 bony anatomy considerations. Thin labial bone or dehiscence requires careful extraction and possibly soft tissue grafting. 14 implant placement. Maintain a 1.5 millimeter distance between implant and tooth for bone formation. Use larger implants in the anterior zone to ensure bone, not soft tissue, fills the gap. 15. Importance of soft tissue around implants. Resists bacteria, prevents recession, and facilitates oral hygiene. 16. Soft tissue around natural teeth versus implants. Natural teeth have a stronger fiber connection, highlighting the need for keratinized mucosa around implants. 17. Timing and techniques for soft tissue augmentation. Can be performed before, during, or in the second stage of implant placement. Techniques like Zucchelli's and flap design are crucial for success. 18. Connective tissue graft, CTG, used to prevent future recession, particularly with thick gingival biotypes. 19. Dual zone concept augments both bone and soft tissue zones, essential for supporting tissue and preventing retrofilling. 20. Intervention in the second stage. Techniques include free gingival graft,